And now to a truly alarming story, sudden outbreaks of hepatitis in children that may have been brought on by COVID lockdowns, weakening immunity to what is a normal virus. Now, there have been 169 cases and 1 death of acute hepatitis of unknown origin found in 12 countries, including 11 right here in the United States. So what's driving this? Joining us now to discuss is cardiologist and epidemiologist Dr. Peter McCullough. Dr. McCullough, now, what have you learned regarding this hepatitis issue with kids and lockdowns and these spikes?
Now, Laura, this is hepatitis or acute liver inflammation. So these children develop fever, abdominal pain, lethargy, and then jaundice. And the blood tests are easy to employ transaminases and bilirubin to diagnose acute hepatitis. In a report by Marsh and colleagues in Eurosurveillance, 13 children in Scotland, all hospitalized. 1 needed a liver transplant. 5 of them had COVID-19 implicated around the time of the diagnosis of hepatitis, but there are always other viruses involved, namely adenovirus, rotavirus, and other enteroviruses. So what we need to know in all these cases is what is their COVID-19 status? Have they had COVID-19, the respiratory illness, and in fact, have they been exposed to the COVID-19 vaccine? We know reports from outside the United States and elsewhere that the adenovirus in particular can be found along with the rotavirus in sewer water and in the food supply. So we need our CDC right now to apply their efforts. They're actually excellent outbreak investigation efforts to these cases as opposed to burn their time and energy on ill-advised mask mandates.
Yeah, bingo. And by the way, this is related, Dr. McCullough, this new study that found that COVID vaccination can elicit what's called a distinct T-cell dominant immune-mediated hepatitis associated with vaccination-induced antigen-specific tissue-resident immunity requiring systemic immunosuppression. Now, explain what the heck that means.
Well, we now have reports by Brill, that one by Boatner, Lenson, and Suarez that have basically demonstrated that COVID-19 vaccination can trigger an acute hepatitis of a variety of mechanisms, one being autoimmune. But the fatal case that was reported by Lenson was actually reactivation of hepatitis C in an elderly individual. So the spike protein in the respiratory illness and then superloaded in the vaccines could be the culprit.
Well, Dr. McCullough, we keep hearing more about the mandates of vaccines for kids, boosters, including another booster perhaps being required next fall for new colleges and universities. It just keeps getting worse on that front, but thank you for being here tonight.